Let's begin this panel by a brief introduction, starting with Dr. Cavazos. Please state your name, your title, and the institution you work with.
My name is Jose Cavazos. I'm a clinician scientist in epilepsy, and I'm at the University of Texas Health Sciences Center in San Antonio. I'm the M.D. PhD director. I'm an assistant dean in the graduate school and the medical school.
I'm Walter Hartwig. I'm Associate Dean of Academic Affairs and Chair of Admissions at Touro University College of Osteopathic Medicine, which is here in Northern California, in Vallejo, California, just down I-80 towards San Francisco.
I'm Joseph Williams. I am the Director of the Office of Multicultural Programs at Case Western Reserve University School of Medicine in Cleveland, Ohio. And among other things, I direct the summer medical and dental education program. I also work closely with our admissions people. I interview students, I review applications, and I work a lot with our PhD programs in the biomedical sciences.
Good afternoon. I'm Robert Ruiz, Director of Admissions at the University of Michigan Medical School in Ann Arbor, and a big Detroit Tigers fan.
Okay, thank you, everyone. Let's begin with the first question, and it's for Dr. Hartwig. And if any other speaker wants to add on, though, please comment after he's done. Dr. Hartwig, what kind of job experience do medical students or medical schools look for in their applicants?
We, of course, see all of the attributes that you submit in your application, work experience being one of them. I don't know that we distinguish very finely between work experience and volunteer or service experience. We're interested in what applicants do with the discretionary time that they have available. That is, how you are who you are, as opposed to a quantity of time served or a particular place in which you serve that time. We recognize that many applicants work in order to meet their financial needs and therefore have relatively little discretionary time at their disposal for service commitments, whereas other students do not need to work or choose not to work during their study time or their time in between graduation and enrolling in medical school, and therefore might have an abundance of time to commit to service and volunteer work. So we try to look across the whole spectrum of work time and volunteer service time for the kinds of decisions that you made. That is, if you had choice over where you put your service effort, what does that choice say about decisions that you might be making 10 years from now, which is when you would have completed our medical program and your residency and be functioning as a professional physician.
Mr. Williams, would you like to add to that?
Sure. I agree with what was said earlier, but I also strongly urge students, if you must work a lot, which I would probably define if you're doing 20 hours or more per week of work at any point during your undergraduate career, to tell us that so that we can use that, put that in the context of the rest of your application, because clearly that would put most people at a disadvantage in terms of fully developing their academic and intellectual skills.
For people applying to MD PhD programs across the nation, the type of experience that we're looking is research experience, biomedical research experience. That's what is the most important component. So it is the depthness of that experience in a particular research lab. So individuals who may have to use that, they need to work in order to be able to support their studies. They are considered very, very well in all these programs, but they need to be considered with the specific alignment to biomedical research.
And adding on to that, I have a question for Mr. Ruiz. Does your school value hospital volunteer experience over research experience?
It's a good question, and I think it's always tricky, and we hear this often from applicants, which is more important, which looks better, X versus Y, A versus B. And I'm not certain that's the best approach in terms of what looks better. I think actually what we do is ask you as applicants to think about it from the perspective of which are you more passionate about, which are you more interested about, which one lends itself more likely to the trajectory and the kind of career that you're interested in within the field of medicine. Which is to say, we'd rather not have you do research if you're not interested in doing research as a major component of your medical education. That's perfectly acceptable if you're then going to devote your time to leadership skills, community service kind of skills. I really think it's better for you to do a handful of things really well that you're passionate about, that you're deeply interested in, that you're committed to, rather than trying to paint this picture of an individual who's done everything. So again, I'm not a big proponent of this idea of which one looks better. My comment would be to you as an applicant, if you were not applying to medical school, which would you be most likely to be doing? Which should then lead you to those activities that you're deeply passionate about, that you're intellectually curious about. I think that will always lead you to the path. This is about what's best for you, what your passions and interests are, as opposed to trying to guess what it is that we're looking for in terms of a prescription, because the fact is there isn't one.
Thank you. Does anyone else want to add on to that? Okay. The next question is for Dr. Cavazos. What is an outstanding trait you look for in a medical school candidate other than academics?
As I indicated, I have been part of the admissions committee for the medical school, as well as I'm the director of the MD PhD admissions program and program. For MD PhD, you are looking for research. Okay. Now, you do want to need to have at least, to say a number, 100 hours of physician shadowing to really convince us and any other program in the country that you really want to become a clinician scientist, a clinician component. So you're written, and not just a PhD, because otherwise, I mean, there's other careers as PhD careers. As again, echoing the panel, there is no one particular formula that is going to be best for all candidates, but every candidate needs to put together their experiences into a particular story, and that story needs to be compelling, and that compelling story may be specific to one disease, one disorder, or it can be about becoming a family practice doctor, and that's okay. But you need to give, again, align your experiences with volunteering experiences, service activities, physician shadowing, and research into one particular package. And that makes sense.
There are some issues that are relative only to osteopathic medical schools. So if you're considering applying for admission to an osteopathic school, in terms of what we might find to be an outstanding characteristic of an applicant, it would be that you took the steps that were available to you to find out about osteopathic medicine directly. That is, the most direct way would be to shadow an osteopathic physician who practices osteopathic manipulative treatment. That can be very hard depending upon which part of the country that you are in, and we recognize that. But if you live within access to an osteopathic medical school, then showing that you took a day or a half day to go visit the school outside of your application to try to sit in on lectures or audit a laboratory, that would definitely distinguish you among other applicants in the region who might not have taken that step. For many applicants who have a range of interests that cross allopathic medicine and osteopathic medicine, you might consider one or the other to be your secondary avenue of choice if you're not admitted to your primary avenue of choice. But if you want to be considered outstanding in terms of that particular attribute, then we would encourage you to show that you made some positive contact with osteopathic medicine to the extent that it's accessible based on where you live.
Yes, go ahead.
Once we establish that an applicant has the academic prowess to be successful in our curriculum, there are any number of other characteristics that we would like to see that we could be impressed with. I think immediately is something like leadership. I personally enjoy, and a sort of a preference for people who enjoy engaging with other individuals and are able to do that with people who they don't know, that they have not met before in the past, because that's what many physicians, most physicians face every day. Here's a stranger who has a chief complaint, and here we go. And a lot of people, no matter how smart they are, just can't pull that off in any meaningful way. And so I like that when I see that in an applicant.
Thank you. The next question is for Dr. Ruiz. How do you define diversity, and how does your school embrace it?
Yeah, it's an excellent question. A couple of key points about diversity. Diversity is important within the medical field for a number of reasons. As you all know, the patient population is changing dramatically. More importantly, increasingly, we're doing work in medical schools as teams, as groups. In order for those groups to function well, you need individuals from diverse backgrounds, perspectives, academic disciplines, ideologies. And I think it's very important to remember that diversity comes in a lot of shapes, sizes, and forms. And I think sometimes diversity gets broken down into race and ethnicity, and while those are certainly two components of diversity, there are a variety of other components of diversity: socioeconomic status, academic discipline, the region of the country one comes from, languages spoken, interest. One could argue that a French major or a philosophy major would bring diversity to medical schools. So diversity is less about, again, what we want, but more about what you will contribute to each medical school class. And at Michigan, we talk often about this incoming class, which will be number 168. We talk about how will you as an individual contribute to that class? How will you contribute to the learning of your classmates? It's why not all of our students are from the state of Michigan. About 45% are, the other 55% come from around the country. So we're very intentional. We have students who are first-generation college students, others who may be the third in their family to go to medical school. And this is where medical schools can then begin to pursue their agendas. At Michigan, it's research is a big agenda. But other medical schools may have primary care or community-based medicine. So you really want to be mindful about your individual attributes and background, the strengths you have, and then trying to align those with schools where you think they'll be maximized relative to the opportunities there. So I would close by saying that diversity really is much larger, has a lot of different components, and you want to be thinking about it in terms of how will I enrich the other members of my medical school class around me? What will I share with them? What can I bring to their experiences that they may not have, to this point, had the opportunity to experience?
Thank you. Mr. Williams, do medical schools take into account the prestige of a school when looking at one's application?
I don't think that most schools consciously take into account the prestige of a school when viewing applications. We certainly do not at Case Western Reserve. However, I cannot say what people unconsciously think. I think we have to be honest and not naive about that. What I like about medicine is that medical education is that when admissions committee reviews an application, we have lots and lots of information to look over, to analyze. And in regards to sort of prestige, my view is that, well, if you think that you are attending one of these prestigious universities, then your MCATs ought to reflect that. So you can't say that you're all that, or that your school is, your university is, unless you can back it up. You know, when I see a 3.7 GPA from one school or from 5 different schools, all that tells me is that the student was able to learn practically everything that the professors had to teach them. But you have to go the next step, the next level, and say, but how much was taught? And so we would typically look towards the MCAT, which everyone essentially is taking the same exam, to help us, look past that first set of numbers and, of course, look at the letters of recommendations from the faculty members that may give us some insight as well.
For the MD schools, the allopathic schools, AMCAS has a resource that admission directors have access to. And that resource indicates the GPAs and the standard deviations at pretty much every single undergraduate school in the country that has at least 5 applicants. So it gives you information to compare what are the likelihood of those applicants, what is the spread out, and what historically, and actually gives you also what was the matriculants. So how many of those people in that particular school, what were their GPAs and their AMCAS. And so you get an idea how to compare apples to apples a little bit better. Because I mean, some schools have curves, some schools have, 3.4 might be an outstanding GPA, and whereas in another school, if you are below a 3.9, it's really not so good.
Yes.
This is obviously a topic that we think about quite a bit, and you probably think about it as well. It's important to distinguish between sort of things that we might look for in an application versus things that you think we're looking for in an application. One of the best attributes of an applicant is evidence or markers that suggest that they have a high expectation of fulfillment. That phrase is kind of loaded there. So much of what happens to you in medical school requires you to fulfill on a schedule, on time, without exception. And so anything that suggests to us that you have fulfilled something in your past helps us with our confidence that you're right at this time for medical school. One of the things that we look for, and I'm not speaking for all of the panelists, but when we see a student who entered and graduated from the same institution in a 4-year time period, we know that that student has fulfilled an expectation. And so we know that you were confronted with a crisis in your life during that time, who wasn't at that age, and yet you were able to fulfill at your institution from beginning to end. So is it an advantage for that student over a student whose transcript does not show the same evidence of consistent matriculation to fulfillment? That's where the gray area comes into play. We all have opinions of schools, for sure, based on the fact that if, say, at my school, for example, 70 of our 135 students on average each year come directly from UC Berkeley and UC Davis, the major public undergraduate institutions that are within our region, and they're both world-class undergraduate institutions. We're delighted to have that level of recruitment from those 2 campuses. So it's only human nature that when we see applicants in now our 16th year of operation who come from similar backgrounds at those 2 institutions, we form expectations. And so if you have a 4-year transcript from UC Davis, that would put you in a different light in our calculation than if you did not, because we've seen so many people from this institution matriculate in that fashion and succeed in our program.
Thank you. Mr. Ruiz, what advice do you give students who make the decision to become pre-med late into their undergraduate career?
Good question. My advice for all pre-medical students would be to be thoughtful about the timeline that you're pursuing to medical school. I think that for a number of years, the thought process was that one would finish 4 years of undergraduate experience and immediately take the MCAT and start medical school thereafter. And the fact of the matter is the data nationally are changing to some degree. And I can't speak for all schools, but for example, at our institution, 70% of our first-year class graduated from college 2 years ago or longer. So this idea sort of the traditional applicant, in fact, is the non-traditional applicant now. And what that means is that, and the advice I would offer is that you should take the time to really pursue those things that you're passionate about. And as a result, we get individuals who are very, very enriched, whether they've earned an MPH, whether they've worked for a year or 2 in industry, whether they've taken time off to do research, finish a second major, travel abroad, spend time doing community service work, AmeriCorps, Peace Corps, Teach for America. I think these individuals come to medical school very, very enriched. Obviously, you have to pay attention to the details relative to course requirements, the MCAT exam, but I think those individuals who are now applying, having graduated from college a year, 2 or 3 ago, really come with quite a set of what we would call personal competencies and attributes that become very, very attractive to future physicians.
Thank you.
Nationally, for MD PhDs, about one half or so of the class, matriculant class, is actually people who have taken a postbac, meaning have taken a year out to do additional research. Some of them beef up their GPA because they are high numbers that are in MD PhDs. Nationally, MCATs are around 34 and GPA is about 3.8. That's the matriculant class. And so many people go out, look into research labs and see whether this is a career that they want. And by beefing up that experience, you have a much better packet. And so you might be applying for second time, perhaps with a couple of years in gap, to really boost your application and ability to get in.
Thank you. Yes.
One thing that has come up a couple of times is the word passion, and I think that's probably the single most important word that needs to be attached to your file, because medicine is a career choice unlike all other career choices, and you are committing yourself to one of the highest levels of responsibility and covenant with the people with whom you interact. We want our physicians to be passionate about their care of us, and we look for that in every corner of your application. If you turn to if you decide that you're going to enter medicine relatively late in your undergraduate career or after you've already graduated, you nonetheless have made a turn, and you, from that point, you need to evidence that you are inspired about this choice. If that might only take you 1 year of time to prepare, it might take you 5 or 6 years. We expect to see, even if you declared to yourself when you were high schoolers that you wanted to become a physician, that's the point at which we begin to look for evidence of passionate pursuit of this outcome. So it's less when you decide and more how do you conduct yourself from that point until the time when reading your application.
Thank you. Mr. Williams, what is the difference between a fellowship and a residency?
Well, fortunately, I was married for 14 years to a physician, and I met her when she was a resident, and so I know the answer to this question. The residency is the period of time after you complete medical school. So medical school is typically 4 years. There are some exceptions. And beyond, after that, you have to get some training so that you actually know what you're doing in a specific field. And so typically that is 3 years, but it can be much longer than that depending what you choose to study. After you completed a residency, many people or some physicians elect to get some more specialized training. In the case of my former wife, she did internal medicine as a residency, and then she did nephrology. That is, she decided to study kidneys, which she did in her fellowship. And I don't remember if that was 1 or 2 years. It was a long time ago. And so that's the difference. Thank you.
I'm actually a fellowship director too. And you know, one of the things, fellowship, and it really depends on what is it that you want to do. And a lot of what has been said is, what is the end point that you want to go to? And medicine is very highly regulated. I mean, so you have to, for example, become a cardiologist. Cardiology is a fellowship. Internal medicine is what is required, or pediatrics, in order to become pediatric cardiology, or neurology is a residency, and fellowship is, which is I do, is clinical neurophysiology as well as epilepsy. So I train physicians who are PGY4, PGY5 into the art of how to take care of patients for that particular area of expertise. It is really way beyond your needs at the present time, but just know that the American boards that exist, there are DO and MD boards available, and they have particular requirements of what is it that you need to do after medical school, and that's applicable for both MDs, DOs, or MD PhDs, DO PhDs, etc.
Thank you. Dr. Hartwig, how does your school view multiple mini interviews compared to the traditional individual interviews?
This is a very sensitive question for me because our school is maybe one of the last programs to hang on to a very traditional format of interviewing, which is a panel format in which 3 to 5 interviewees will be in the room with 3 interviewers for an hour-long experience. It's very old-fashioned, and I, as the chair of admissions, have asked that we move along and sort of join more current methodologies, such as a multiple mini interview format. But my faculty have always voted strongly in favor of the group experience because they like to have multiple ears on the same voice. So when you answer a question about why you're interested in osteopathic medicine, my faculty like to have an osteopathic physician, an academic faculty member, and a student hear that answer and bring an opinion to it when my committee meets. So we have a different way of doing things for that reason. My own personal opinion of the multiple mini interview format is that it takes a lot of the subjectivity away from how your experience with your interviewer in a traditional one-on-one setting might work against you, because in a multiple mini interview format, each applicant is subjected to the same 8 to 10 standardized questions that will apply, or themes, maybe not the exact wording, but the themes that will apply to all applicants for that year. And your evaluators in those mini sessions, typically 10 to 12 to 15 minutes per session, your evaluators have been trained and coached using a rubric on how to interpret your answers so that they can be as systematic as possible to your answers. Benefits abound there because the university has set forward what they want to ask you and how they're going to evaluate what you say. I think there's positivity in any direction in which you have an applicant live in your presence for an hour to talk about why they're interested in going to medical school and being a physician.
Thank you. And I wanted to ask Mr. Ruiz, how does your university or school do the interview process?
Good question, and one of the things you want to be certain of as an applicant is the kind of format a medical school uses for the interview, so that you know what to expect. I still remain firm that the best way to prepare for an interview is to really know your application, what you've written, why you've written about it, because the reality is many of those questions will come from your application. Whether it's a panel interview, whether, as is the case at Michigan, there are 3 30-minute one-on-one interviews with a faculty member, an alum, and a medical student, whether it's the MMI, although you won't get questions necessarily from your application, there'll be questions about topics or themes that you likely will have covered in your application, issues of decision-making, ethics, integrity, problem-solving. So I think first and foremost, you want to make sure as an applicant, what kind of interview does that school do? Secondly, the best way to prepare is to make sure you understand your application, what you've written, why you've written about it, and to be prepared. Although I would differentiate between being prepared and being scripted. I don't think you want to be scripted to the point where we literally ask you a question and you start an answer before we finish the question that we know you've used exactly in the same format 30 times before. It's okay to freelance a bit, to talk about your passions, your interests. So you want to be prepared but not scripted. And again, understand that the interviews are important. They give us an opportunity to learn more about you. We're certainly assessing communication skills. By using the MMI or other kind of interview models, we might be assessing teamwork or collaboration skills. But also don't forget, this is your opportunity to interview us as an institution. Is this the kind of community that I want to spend the next 4 years a part of? Is this an environment where I can flourish, where I can be happy, where my quality of life in and outside the classroom will be sufficient for me to continue to grow? So don't forget, although I know it's anxious and you're nervous at interviews, don't forget it's your opportunity to ask us questions, to challenge us from the standpoint of making certain we have the resources, the environment, the culture, the climate that's necessary for you and the kind of place that you want to spend the next 4 years, or in the case of MSTP, perhaps 8 or more years.
Yes.
At Case Western Reserve, each applicant will have an interview from either a faculty member or a staff person, typically a faculty member, and one student, which will be separate. And what I always like to remind people or let them know is that those interviews are both weighted equally. I think students, applicants often think, well, obviously the faculty, vote counts for more than the student, and that's not true. There's a question that we ask the student interviewers is, would you want this person? Would you want this person? Do you see this person as a potential colleague in your future? If our student interviewer says no, your chances go way down. And they don't just say no, they explain why. And so you want to take that seriously. And also, if during the course of an interview with a student, remember, they will be commenting on how the interview process worked. And so if for some reason you decide that you're going to ask that student for their email address, be sure that it's clear why you're asking, because it could be deadly if it's for a reason that the other person might be offended by. I'll get my drift here. Okay.
For MD PhDs interviews, again, it's across the country. Every school has a different way of doing things, but it's a bit different. It's more intense, particularly because we are investing $500,000 on you. I mean, it's a 7 to 9 year program. We are paying your medical school, your graduate school, and giving you stipend throughout these 7 to 9 years. So we are investing 2 days in asking you questions, meeting students, meeting faculty, and also asking you to do a chalk talk. No slides. Tell us about your science. Do you really understand your science? I mean, this is the real thing. I mean, this is why we are investing this kind of monies. So what is it that you do? You need to do it passionate, but you need to understand it. And, MD PhDs is programs. There are 110 of them in the country. And so there's plenty of locations, but every school has very few slots. That's why most of the students apply to 20 or so schools.
Thank you. My next question is for Mr. Ruiz. Does taking summer pre-med courses in a community college while in university look bad on an application?
Good question. The answer is not necessarily. Again, the reality is if you're in college now, based on a whole variety of factors, courses that are offered in particular semesters or quarters, if you're working, if you have other family obligations, the fact is you may not be able, or let me phrase it this way, it's increasingly difficult to graduate from an undergraduate institution in 4 years and do the kinds of things that may be of interest to you. So increasingly you may have to take courses throughout the summer, 1 term, 2 terms, and our position is that to the extent you can do that at your home institution for the majority of your coursework, I think that's certainly acceptable. But we're also realist. If you are from Southern California, you attend Berkeley, and you're back home and you need to fulfill one requirement or take one course in Southern California at a local college or community college, I don't think anyone's going to hold that against you. This again is this idea of patterns versus isolated incidents. Isolated incidents are okay. If you take 1 or 2 courses here or there, transfer a course because of scheduling, transfer, movement, summer work, etc., I think that's fine. But we are going to be suspicious if you're a student at UC Davis and you took all of your summer, all of your pre-medical coursework in Southern California at a community college. That's going to make us suspicious. But again, we're realists. We understand to get all of this done, and we're asking you to do a lot in terms of your academic work, follow your passion, if you're doing research. So you may have to add a course here or there in your hometown, your home community college. I think that's certainly fine. But again, I think you want to challenge yourself as best you can, and that typically is going to happen at your home institution.
Thank you. My next question is for Mr. Hartwig, or Dr. Hartwig. Looking back at your own experience in medical school, what would you have done differently And what advice would you give to future applicants?
I think I understand the question, but if you look at the letters after my name, you'll realize that I never did go to medical school. We certainly have students I would describe as students who might have done things a little bit differently. There are so many different answers to this question, I don't want to take a lot of time with a particular one, but where we see students encountering struggle are students who do not have ready access to what we call broadly their support system, meaning that many students will encounter a volume of information and a pace of its delivery unlike anything they've ever seen before. And that cuts across your GPA and your MCAT and where you went to school. And it's human nature to fall back upon or to reach out for the kinds of non-academic activities and social connections that make you feel more rounded as a human being. And so where we find that students cannot move forward at the rate that we would like them to keep moving forward, it's when they're dissociated from the kinds of things that they consider to be their own support system. For some of you, it might be the bicycle in the trunk of your car and just an open road, and you can access that very quickly from wherever you are. But for other people, it might be getting together with their old college or high school friends for Thursday night bowling. And if you're halfway across the country, you can't do that when you really want to, and that can begin to erode your morale and your sense of energy. So one thing to keep in mind is that if you look at the matriculant trends at medical schools, you'll see that even the private schools tend to have a student body that is more regional, comes from the region around it, more so than it does not, especially for a private school. And one of those reasons is because candidates stand out when they do have ready access to their support system and they carry it through.
Every fall, I invite all of the new minority first-year students to my house for dinner, and we try to make it a pretty good dinner. And the major message that I have this sort of 10-minute speech that I give, and they're all first years, so they don't roll their eyes yet. And the major message that I give them is, they hear this phrase throughout their 4 years, is do not suffer in silence. Do not suffer in silence. Oftentimes, students will have a problem of some kind, and they're sort of tearing them up. It may be, not very much at the beginning, but it gets really bad, and they don't do anything. Or worse than that, they don't do anything that's helpful. They'll do destructive things to themselves mostly, sometimes to others. And I say to them, tell somebody, preferably tell somebody who can help you or who can get help for you. Something like, I think the last I saw, something like 75 to 80% of all students in medical school at some point before they graduate will seek some kind of mental health services. Sometimes it's just one visit. Sometimes it's more. Most times it's not particularly serious, but sometimes it is. And I've seen a number, too many really sad cases when, a roommate, a boyfriend, girlfriend, close friend, sort of close friend, but somebody who's known you for a while has just looked the other way while a student falls further and further behind. And I don't mean falling behind academically, necessarily. And so I always tell them, you all have responsibility to look out not only for yourself, but for one another. And I think that's really, really key. Do not suffer in silence. And that goes for undergraduates as well.
Thank you. And with our last 5 minutes, I have one final question for Dr. Cavazos. What is one thing you do not want to see in a personal statement?
What I don't want to see? Clearly, what we want to see is commitment. Commitment and passion for research, for So somebody who is collecting degrees, or somebody who is, having a clear, so one of the questions that you always have is, have you had misdemeanors? Have you had any problems, any gap of, for whatever reason, for example, you may have a really bad year and not explain it. So what I want to see is consistency, coherence between the entire application. I want to see that the letters, where you have waived the ability to see them, so they are real letters of recommendation. I want to see that the packet makes sense. The packet is indicative that is an individual who we really want to invite for an interview. As you know, the gaps, the first piece is to go into the door and get invited. So my medical school, for example, receives over 4,000 applications. Medical schools in Texas, which is something that I want to tell you, because of state legislators, they require 90% to be Texans, okay? So the medical school has a different system called TMDSAS, and 90% has to be Texas residents. As an out-state applicant, you have only a 16% chance of getting in. In-state is 42. So, but for MD PhDs, it doesn't matter where you're coming from. It doesn't matter, and that's across every single one. Michigan, Case Western, I don't know if you have a DO PhD, but every single one, because we are required by NIH to do this. We are recruiting nationally, and that's why we're here. So what I want to see is in a series of commitments. What I don't want to see is a student taking a cavalier approach to certain things. I don't want single one-liners for an essay. I want to demonstrate that somebody is concordant with their experiences and have used their time and their opportunities to the maximum.
Thank you. And with that I wrap this up. Thank you. I want to thank all the panelists for coming out. Can we have a round of applause for them, please?